Good day. So today I will demonstrate the management for prolapse umbilical cord. So first thing to do is to gather all the materials and equipments needed. The rationale for this is for easy accessibility for the inspection of the external genitalia, vagina, and cervix. Good afternoon, ma'am. I am Ara, and I will be your nurse for today. I will do internal examination to assess the progress of your labor. After identifying the client and after introducing yourself to the client to establish rapport, you can now assess the client if she can follow the instruction. And if you think that the patient has the ability to follow the instruction properly, then you can now proceed to step 3, which is the positioning of the client. So, there are 3 positions employed for internal examination. First, dorsal recumbent. Second, Sims position. And third is the niches position. Position depends on client's capability and also the examiner's preferred position. So, let's start. Now, I will position the client. So, the position that I will be doing is the dorsal recumbent position. So, this is what dorsal recumbent position looks like. You have to bend the knees of the client and there. So, this is what dorsal recumbent position looks like. And then, next is I will show you another option or another position, which is the niches position. So let's start positioning the client in niches position. Next position is the niches position. Niches position looks like this. In performing this niches position, you have to be very careful, especially on the womb part of the patient. So, the aforementioned positions are made best so as to expose the gynecologic area to be examined. Now that we already know what niches position and dorsal position looks like, we will now proceed to the actual, wherein we will have to tell the client the next procedure that we will do. So, for example, in positioning the client, you have to tell the client, for example, ma'am, I will be positioning you on the examination table to check for the progress of your labor. Is that okay? So, I will position you now in dorsal recumbent. After positioning the patient, drape the client and expose only the gynecological area. The purpose of this is to maintain the privacy of the patient and also to avoid awkward moments. After putting drape on the patient and exposing only the part that I need to assess, wash hands and put on examination gloves. So, let's tell the patient all the procedures. So, for example, ma'am, I will do hand washing, then I will put on examination gloves for the internal examination, and I will change into sterile gloves after I assess your progress of labor. It is very important to tell every procedure to the patient so that you can lessen the anxiousness or the fear that the patient may be feeling. Ma'am, while I insert my 2 fingers, kindly take a deep breath while I do the internal examination. if I see a cord protruding on the vaginal, I will handle it carefully. So you don't have to worry. Next step is assess the well-being of the fetus and the fetal heart rate. So, I will now be assessing the fetal heart rate of your baby by putting the stethoscope on your abdomen. Cord prolapse is first discovered only after the membranes have fractured. When the FHR is discovered to be unusually slow or a variable deceleration FHR pattern suddenly becomes apparent on a fetal monitor. To rule out cord prolapse, always assess fetal heart sounds immediately after rupture of the membranes, whether this occurs spontaneously or by amniotomy. So if you are in a SEMO facility, report the findings to the obstetrician for emergency cesarean section. If you're on a BEMOC facility, then you have to do the following steps to manage the prolapse of the umbilical cord. So these are the steps to do when you are in a BEMOC facility. So first is to position again the patient in a knee chest position, and you have to assist the patient in doing so. Okay, so ma'am, I will assist you in a knee chest position, and take a deep breath and do not bear down if you have the urge to do so. After positioning the patient in a knee chest position, you have to put on sterile gloves before doing the procedure. The next procedure. So next procedure is elevate the presenting part by filling the urinary bladder by inserting a catheter, and instruct the client not to bear down. So let's tell the patient, ma'am, I will be inserting a catheter that will inflate your bladder by a sterile fluid to help in reducing the compression on the prolapse cord. So, ma'am, I will do it now, okay? We will now put the catheter in the patient's vagina. So, let's say this is a catheter. And then we have to insert it in the patient's vagina. In doing this step, take note, do not remove your fingers until you arrive at the operating room or by instruction of the obstetrician. And then next is to tell the patient that you have to put your hands into the vagina to push the head of the baby upward. So, for example, ma'am, I will put my glove hands into your vagina to push the head of your baby upward, and take a deep breath when you have the urge to bear down, okay? Okay, so 1, 2, 3. I will now lift up the baby's head. Okay. Next step is to call out the time of birth and the gender of the baby. So, I will call out the time of birth and the gender of the newborn. If the newborn is with good cry, I will proceed with EINC. If it is not crying, I will cut the cord and resuscitate the infant if needed. So, let's try. A.M. Baby Girl de la Cruz. So, after doing all the procedure, I will now remove my gloves and wash my hands. Remember, hand washing is very important for the infection control. And of course, the final part of every procedure, you have to document the date, time, and the procedure that was done to the patient to provide the accurate data in the care of the patient. So that ends our cord prolapse management. Thank you!